Good afternoon. I think it's 2:15, so why don't we get started? I'm Margie Morgan. I'm the medical director of microbiology at Cedars-Sinai Medical Center, and I'm happy to talk to you this afternoon for 3 hours and about that long or longer tomorrow about what I love so dearly. And we're going to start today talking about mycology. So there you go. So let's get going. Okay. This is Mycology Update 2026. And get ready, it's going to be 2 hours worth of mycology, and I hope you find it interesting. I love mycology. It's really become such an important area of study in microbiology, and it's also important for your board exam. And I'm going to find the best way to advance my slides here. Okay, and so the starting points for mycology. First off, there's two types of organisms that we deal with in mycology. We have yeast and molds, of course. So let's start with yeast. They're unicellular and they bud to produce daughter cells like shown in the picture. There's growth on solid media. They usually grow very easily, and they produce white to beige colonies in the first 24 to 48 hours. And they can look a lot like bacterial colonies. They can grow in a variety of different media, like shown in the pictures at the bottom. Candida albicans, when it first starts to grow on a sheep's blood agar plate, looks very much just like staph epi or something. It grows very well at 24 hours at 35 degrees centigrade. Yeast will also grow on media such as shown on the right-hand side called saborods, which we'll talk about in a moment. So they grow rapidly, 24 to 48 hours, and they can look very much like bacteria. A few of the genera actually produce pigment, like the one over on the right-hand side. This is Rhodotorula. You can see it has a beautiful orange-red salmon color. Some of the genera will also produce very wet-looking mucoid colonies, like the one on the bottom right. That's a Cryptococcus neoformans colony, and it's mucoid because it produces a polysaccharide capsule. One thing that we need to remember as we do this lecture, and as you're probably doing rotations in your own microbiology laboratories, the yeast have undergone massive taxonomic change over the last decade. And so the way that we're supposed to do this is we put the new name first, and then the old name is in parentheses. And I have no clue what boards might use the old name, the new name, or the proper taxonomic way of doing things. So I'm doing it the way it's supposed to be done, and then you'll have both the old name and the new name. So molds. Molds are the second type of organism. They produce hyphae and conidia that we can also call spores. They grow on solid media and produce fluffy or downy colonies like shown in the pictures below. They can have a variable time in growth, anywhere from 3 to 21 days, and they can grow in a variety of temperatures as low as 25, but usually you think of growing molds at 30 to 35 degrees centigrade. Mold colonies are usually pigmented, which can assist with presumptive identification. As you see the pictures below, one's green, one's purple. They can be very, very helpful in the presumptive ID. They've also gone taxonomic updates, and I will put the new name first and then the old name in parentheses. Safety precautions are very important in the mycology laboratory. You need to use BSL-2 level safety precautions, and you use a BSL-2 biosafety cabinet with HEPA filtration whenever you are working with mold cultures. Those conidia can fly and go all over everywhere, and you certainly don't want people working in the laboratory exposed to molds. You can see a picture of a BSL-2 biosafety cabinet on the right-hand side. Yeast procedures can be performed safely on benchtop. The personal protective equipment that you should wear when working in mycology include lab coats and gloves, and all of your biohazardous material must be autoclaved. Agar plates are usually used in most mycology laboratories these days, and when you use plates, you must seal them with oxygen permeable seal, as shown in the picture on the right, when you're plating for fungal culture. This is to protect the laboratory workers from any spore formation that could occur from molds growing on the plates. Specimen collection and transport. Fungi are very hardy organisms. Transport media is usually not required, just a sterile container to prevent bacterial contamination, and you put the specimen in that sterile container, and room temperature is quite adequate for transportation. There's numerous anatomic sites that are appropriate for culture. I've listed some of them. You can do any kind of respiratory, sterile body fluids, tissues, anything where you think there might be a fungal infection. What are the most common fungal culture media? Well, let's start with Sabarod's dextrose agar, known as SABS. This is an all-purpose fungal media, antibiotic-free. It's been used in mycology laboratories for decades. The problem potentially with it, it can grow bacteria from contaminated sites. There's no antibiotics or anything really to prevent bacterial growth. It contains 2% glucose at a pH of 5.6, and it's usually used best for the subculture of fungi to be tested for identification and susceptibility testing. The most used agar these days is inhibitory mold agar, or IMA. It's a selective and enriched medium. It contains antibiotics, chloramphenicol and gentamicin, to inhibit bacterial growth that commonly occur in a lot of the specimens that you're going to do fungal culture. And these antibacterial agents help a great deal prevent the contamination of the culture and the bacteria overgrowing yeast or fungal organisms that might be present. So this becomes a very good medium for the primary recovery of molds. There's also a unique media known as mycocell or mycobiotic agar. This is a highly selective SABS-like medium that contains chloramphenicol and a substance known as cyclohexamide. These are used primarily to culture dermatophytes. These are, of course, the molds that cause hair, skin, and nail infections. This should not be used as a primary plating medium from all sites, because cyclohexamide can prevent some very important pathogenic fungi from growing, specifically Trichosporon, Candida tropicalis, and Cryptococcus neoformans and Gattii. Brain heart infusion or BHI medium. You can have it with or without blood. This can be used for primary recovery of fungi. It also usually contains chloramphenicol and gentamicin to prevent bacterial growth.